All right, so looks like we've got everybody who's coming, so we will go ahead and get started. Hopefully everybody can hear me. If you do have any issues with being able to hear me, please let me know through the chat if possible. Hopefully everybody got the email that I sent out just a little while ago that included these slides and the handouts for tonight's presentation. As usual, I will pause during the presentation to see if there are any questions from any of you. You are welcome to either type questions into the chat box or simply unmute and ask your question when I do pause for questions. We've got quite a bit of information to cover tonight, but it will not be a very long session, so hopefully we'll get you guys out of here fairly quickly. And I think that's all of the housekeeping that I had, so let's go ahead and get started. Oh, actually, hold on just one moment. All right, so again, thank you for joining us for part 4 of our 4-week Medicare 101 series. Tonight, we are going to talk about Medicare and all types or a lot of other types of health insurance options that may be available to beneficiaries once they are enrolled in Medicare. Again, as I've mentioned every week, we are with the Area Agency on Aging, which serves a 3-county area, El Paso, Park, and Teller. And the mission of the Area Agency on Aging is to work with partner communities to coordinate and develop systems that allow people to stay in their homes for as long as possible, to stay in their homes and in the community. Again, my name is Roma. I'm with the Area Agency on Aging through the Pikes Peak Area Council of Governments, and I am with the Senior Insurance Assistance Department, which is the State Health Insurance Assistance Program. The SHIP program for this area serves a total of 9 counties. And the purpose of the SHIP program is to provide free, unbiased information and education on all things Medicare. Every county and every state should have access to a SHIP program, if nothing else by toll-free statewide number. And I have listed both our local Colorado Springs number as well as the statewide toll-free number. Quick review of what we've talked about previously. Week 1, we covered eligibility, enrollment, and benefits and costs of original Medicare, Parts A and Part B. In week 2, we covered other insurance options to go with Medicare, including Medicare Advantage plans, also known as Medicare Part C, and Medicare supplements, also known as Medigap. And then last week, we talked about Medicare Part D, the prescription drug benefit for Medicare, how it works, what it costs, etc. So tonight we are going to talk about a whole variety of different kinds of health coverage that might be available for people to go with their Medicare, including active employer coverage, which can also include COBRA, retiree coverage, military coverage, Medicaid, and the marketplace. So we are going to start with employer coverage. As I've mentioned before, if someone is still actively employed when they become eligible for Medicare, they would have the opportunity to delay enrollment into any part of Medicare in favor of health employer group coverage through that active employment. And that could be for the employee and or their spouse. So if you are still actively employed, you have employer group health benefits through that employment. You can choose to delay enrollment into both A and B of Medicare. And if you choose to do that, when you no longer are actively employed, you would have an extended amount of time, an 8-month window of opportunity to enroll in Medicare A and B without any penalty. Or you can enroll in A and B at any time while you're actively employed after your initial enrollment period. You can choose to enroll in Medicare Part A if it's at no cost to you and still have employer coverage, or both Part A and B with employer coverage. Keep in mind that depending on the size of the employer, which would be for most people turning 65, if your employer is 20 employees or more, the employer coverage is primary, Medicare is secondary. So it may or may not be to your benefit to pay the additional premium for Medicare Part B if you are still actively employed and covered with employer group coverage. It may be beneficial to do that if you, say, have an employer group health coverage that has a high deductible or a large out-of-pocket. A and B as secondary to employer coverage may actually be able to pay some parts of some claims. But again, it would depend on what kind of employer coverage you have and how that benefit is structured. And it may also depend on what you're paying for it. Keep in mind that employers cannot require anybody who becomes eligible for Medicare to enroll in Medicare. That is actually honestly against the law. So as long as you are actively employed and that employer offers and you are eligible for employer group health coverage through that employment, you are able to take advantage of that employer group coverage. And you cannot be enticed, coerced, or told that you have to enroll in Medicare in favor of the employer group coverage. For many people that are approaching Medicare eligibility or age 65, that eligibility may come shortly after you've decided to no longer work. In that situation, or in any situation where someone loses employment, whether it's based on retirement, you got laid off, whatever, the government provides you an opportunity to continue the coverage that you had through that employer, that health coverage, through the COBRA Act. COBRA stands for Consolidated Omnibus Budget Reconciliation Act, or COBRA for short. And it basically provides an extended window or an extended benefit of that employer coverage as you had it while you were employed for usually at least 18 months. There are some scenarios where that employer coverage may last longer than 18 months. Anybody who's who becomes eligible for COBRA coverage based on their scenario, again, when employment ends, or if you are no longer eligible for the employer coverage, and that could be because you've been laid off, because your work hours were reduced to the point where you're no longer eligible for the employer coverage or what have you, you can continue that health benefit for at least 18 months, keeping in mind that if you choose to take advantage of COBRA, you do usually end up paying the full monthly premium for that coverage. Whereas while you were employed, the employer paid a good chunk of it and then you paid a chunk of it. When you are taking advantage of the COBRA continued benefit, you pay the full monthly premium. This is available for, again, the employee who is no longer eligible for the employer health benefit, and or their spouse and possibly dependent children. If the covered employee becomes entitled to Medicare, if there is a divorce or a legal separation of spouses, the death of the employee, or the loss of a dependent child status. So there are many scenarios that might allow someone to take advantage of COBRA continued coverage. And there are some situations that do not allow for continued COBRA coverage. So if you become, say you retire at age 64, you have another year before you become eligible for Medicare automatically at age 65, but you need to have continued health benefits and you are entitled to COBRA, you can use that COBRA benefit for that 12-month period until Medicare goes into effect. As soon as Medicare eligibility becomes a real thing, so the month you're actually eligible for Medicare, whether you enroll in it or not, if you are enrolled in COBRA, as soon as you become eligible for Medicare, COBRA coverage eligibility ends. Now it ends for the person who becomes Medicare eligible, but if you are also covering a spouse or dependents under that COBRA coverage, they would be allowed to keep that coverage. And in this situation, they may be able to extend that coverage beyond the 18 months for almost an additional 18 months. If you were employed, you became eligible for Medicare, and you enrolled in Medicare prior to that employment ending. And when that employment ended, you are still entitled to take advantage of COBRA. However, it's not something that I would suggest would be a good idea, because again, you're already enrolled in Medicare, you're paying the premiums for Medicare. COBRA coverage is not considered creditable coverage for the purpose of delaying enrollment into other benefits that might be available to go with Medicare, such as Medicare supplements or Advantage plans or drug plans. So if you choose to continue enrollment in COBRA, even if you're already on Medicare, keep in mind that that extended COBRA coverage is coinciding with any of the enrollment periods you have or opportunities you have to enroll in Medicare related coverage, such as the guarantee issue into a Medicare supplement or the initial enrollment into a Medicare Advantage plan or Part D plan. Now, there can be some exceptions to all these rules. COBRA can be confusing and the rules can be complex. So if you have questions or if this is something you're interested in getting more information about, I did include a handout about COBRA in the email that I did send earlier today. But again, you're always welcome to call your local SHIP office, that's us, and we're happy to help work through the intricacies of the situation and help you better understand your options regarding COBRA. Any questions about any of that? Again, if you have a question, you can simply unmute, or you're welcome to type a question into the chat box at any time. All right, I'm not hearing any questions, so we're going to talk about retirement coverage. So if you are fortunate enough to have worked for an employer long enough and they offer their retirees health benefits because you were employed for however long it took to earn those benefits, that might be a very viable option to consider to use with Medicare versus, say, going into a Medicare supplement or Medicare Advantage plan. Whether or not it's offered by a previous employer is absolutely, positively, totally up to the employer. So some companies may offer it, some companies may not. The other thing to know is that every single company that offers an employer retirement health benefit may offer a slightly different benefit than any other company. So employers are actually able to customize what kind of benefits they are willing to offer retirees, both pre and post Medicare, and how that coverage would coordinate with Medicare. Things to take into consideration if you're looking at the option of employer health benefits for retirement. First and foremost, you probably need to make sure that any drug benefit available through that employer retirement benefit is creditable, meaning it's at least as good as what Medicare Part D offers. As long as that benefit is creditable by Medicare standards, you're good to go. You wouldn't have to consider enrolling in a Part D. Also keep in mind that employers are by federal mandate required to provide you written statement or a written notice every year as to whether or not their drug coverage, whether it's through active employment or retirement benefits, is considered credible by Medicare standards. And that is something they should provide to you in writing every year. Again, every employer can offer a different retirement benefit, and that's for retirees both not yet eligible for Medicare and for retirees eligible for Medicare. When it comes to retirees eligible for Medicare, things that you would want to look for regarding the retirement health benefit option would be as to whether or not that option is designed to coordinate with Medicare. There are many different kinds of ways that an employer can offer retirement benefits. Some of the ways that they can do that is they can take basically a standardized supplement, which we talked about in week 2, and change it. So even though I said supplements are standardized or set in stone, when it comes through an employer, it's not really considered a supplement, so they can customize those benefits and either add or subtract coverage from what we would normally call standardized. The same thing would apply to any Advantage plan option that they might offer. So some companies choose to simply customize similar benefits that would act or coordinate directly with Medicare. Some companies have chosen to a third-party agency that works with their retirees, but actually offers only the standardized supplements or Advantage plans. In those scenarios, the number of plans that you have to choose from through this third-party coordinator is probably going to be more limited than if you went out on your own. On the other hand, typically employers who have employed this strategy, sometimes they will provide a subsidy to help cover the cost of those benefits by going through the third party. Sometimes they don't. Other employers may choose just to provide a subsidy, meaning a lump sum of cash that you can use to get reimbursed for maybe your Medicare Part B premiums or any amounts that you spend on buying your own Medicare supplement or Advantage plan. Or it could be a combination of any of the above. So if that is an option that you might have through a previous employer, it would be very important for you to reach out to the Human Resources Department of that employer and get the specifics on how the benefits that they are offering works for you or coordinates with Medicare. Other things to take into consideration, again, I mentioned whether or not the drug coverage is creditable if it's offered through the employer plan. And comparing cost is probably going to be one of the biggest things that you would want to consider. If you're offered a retirement benefit through the previous employer, do you have to pay for it? If you have to pay a monthly premium for it, how much is that premium? Does it include the drug coverage that's considered creditable or not? Other things you'd want to take into consideration is, does the employer health benefit have deductibles, copays, any out-of-pocket expenses? And compare that to what you can get out on your own, either as a standardized Medicare supplement or Medigap with a Part D or an Advantage plan. When it comes to looking at the costs of coverage and which is going to be more cost effective, that is probably going to be usually the most effective means to base a decision on. However, other factors could come into play as far as, you know, someone's preference for a particular insurance company or kind of insurance, whether or not any of those options are participating with the providers that you may or may not want to keep. How easy is that coverage that the employer is offering? So for example, is it an HMO where you're limited to where you can go for services and who you can see? Or is it a more open provider access where it's good anywhere that Medicare is good? All of those things would want to be considered when deciding whether or not to go with a retirement benefit versus just going out on your own and getting a supplement or a Medicare Advantage plan. Some larger employers do tend to offer some very good options for retirees. So for example, if you are a PERA retiree, or if you're a federal civil service retiree that has access to the federal employees health benefit, if you're a retired military, all of those options are very, very good options that are able to coordinate with Medicare. PERA employees or PERA retirees, PERA customizes options specifically for Medicare retirees. The federal program doesn't change benefits, but those benefits do become secondary to Medicare and they coordinate and pick up Medicare balances. And retired military, which we're going to talk about next, once someone becomes eligible for Medicare, TriCare goes to TriCare for Life, and it is absolutely designed to coordinate with Medicare, and it does have creditable drug coverage. All of those options have creditable drug coverage. We do work pretty regularly with all three of those systems. So if anybody had any questions about those particular kinds of retiree benefits, we would be more than versed and able to help you sort through those benefits. Any questions about any of that? All right, I don't hear any questions. I don't see any questions. So now we will talk about retired military and veterans. So I'm in Colorado Springs. In my county, there are at least five military bases in this county alone. So we deal with a lot of retired military who are becoming eligible for Medicare. Before Medicare eligibility, most retirees, if they're not actively employed with employer coverage, may be taking advantage of TriCare benefits, which have very low costs and have easy access in this area in particular. If someone is a retired military person, whether they are taking advantage of TriCare prior to Medicare or not, they would certainly want to consider taking advantage of TriCare once Medicare eligibility becomes a factor in their situation. If someone is using TriCare and they're not actively employed when they become eligible for Medicare, TriCare does require that they enroll in Medicare, and the TriCare that they have turns into TriCare for Life. To be eligible as a retiree for TriCare, you have to have served those 20 plus years and be honorably discharged. Again, but if you are actively using TriCare when you become eligible for Medicare, you are required to enroll in Medicare A and B. You can provide that information to the DEERS system, and your TriCare will automatically change to TriCare for Life, which acts very, very similar to a Medicare supplement in that it pays 100% after Medicare for any balance that Medicare leaves over, and it includes creditable drug coverage. To be quite honest, if you are retired military and you have Medicare and TriCare for Life, you probably have some of the best coverage available in this country today. So you would not need to enroll in a Medicare Advantage plan, a Medicare supplement, or a Medicare drug plan if you are Medicare and TriCare for Life. If you are still actively employed and you have employer group coverage and you're not using your TriCare benefits when you become eligible for Medicare, again, because you're actively employed, you have employer group health coverage, you can delay enrollment into Medicare because of the employer health coverage. When that employment ends and Medicare eligibility or enrollment happens, you would have the ability to use TriCare, and it would change to TriCare for Life when Medicare kicked in. But if you didn't enroll in Medicare when employment stopped, you would risk losing your ability to use TriCare benefits altogether. So if you're not actively employed and you are eligible for Medicare, you would have to enroll in both A and B of Medicare in order to be able to use TriCare benefits in any way. So just keep that in mind. I have included the website for TriCare at the bottom of the screen. It does provide lots of very useful information for military retirees becoming eligible for Medicare. If you're not a retiree, but you are a veteran, and I get this question a lot, veterans are eligible to use Veterans Administration services if they are determined by the VA to qualify for those services based on disability, based on income, and based on medical need. If you're approved for veterans benefits, it does provide for most people the ability to use VA medical facilities and pharmacies. I do talk to many veterans who access the VA system exclusively, and they use that as their primary care. And so when Medicare eligibility comes around, I get the question quite often is, do they have to enroll in Medicare if they use nothing but the VA and they're happy with that system? And my answer is always, it's up to you. VA benefits are not actually considered healthcare, and they are not coverage through active employment. So if a veteran who uses the VA system and is very happy with that system chooses not to enroll in Medicare, they can do that, just like anybody else can choose not to enroll in Medicare. But if down the road they decide that Medicare may be advantageous for them and they enroll in Medicare during an annual enrollment period, they are going to be penalized and pay more in premiums for not having enrolled when they were first eligible. Again, that's because VA benefits are not considered creditable. It's not active employment, and it's not actually considered healthcare. There are advantages for veterans to enroll in Medicare, even if they are using VA exclusively. When someone is accessing the VA health system, that access is typically based on the disability that was determined when they became eligible to use that system. And for the most part, that system is going to take care of any medical needs they have related to that disability. But it may not necessarily take care of needs outside of that scope. If that VA person were to also enroll in Medicare when they become eligible, they would also have access to Medicare providers anywhere for any reason whatsoever. Medicare does not coordinate with the VA, and the VA does not coordinate with Medicare, except for in very rare circumstances. So having Medicare in addition to having access to the VA system can be advantageous because, again, Medicare is good anywhere for any reason, whereas VA services may be more limited. And you may sometimes find yourself in a location where VA services simply aren't available. The benefit of keeping the VA system is, regardless of whether or not you're using the VA system, down the road, you may still have access to their long-term care services and supports, which can provide additional long-term care benefits, such as care at home, that would not normally be covered by Medicare. So the ability to have both kinds of options at the same time is not a bad deal. But again, if someone chooses not to enroll in Medicare in favor of VA, they absolutely can do that. But if they want to enroll in Medicare later, they will pay more. Now, the VA pharmacy system is considered creditable coverage for Medicare purposes. So if someone chooses to enroll in Medicare and use the VA system, they would not need to enroll in a Part D because the VA pharmacy is considered as good as or better than Medicare's benefit. So that is one good aspect that would save even more money. But again, it is absolutely a choice, but it would be a choice that if you chose not to enroll in Medicare, you would pay for more down the road. Any questions about any of those benefits? And I know this is just a very brief overview of all these options, but again, at any time someone would have additional questions or want to talk about their situation in more detail, you're always welcome to call us or send us an email, and we're happy to look at your individual situation. Okay, so I'm still hearing no questions. I'm not seeing any questions in the chat. So now we're going to talk about Medicaid. So Medicaid versus Medicare. Medicaid is a state-based system whose eligibility is based primarily on income and need, whereas Medicare is a federal system whose eligibility is based on having earned or paid into that system to be eligible for those benefits when you turn 65. Whereas Medicaid is available to anybody at any age. And again, it's typically going to be based on income and need. So Medicaid programs are funded through both state and federal dollars. In Colorado, if you wanted more information about the Medicaid system, you could go to the website that I listed, connectforhealthco.com. For people under 65 or people who are not yet eligible for Medicare at any age, could be eligible for what's typically referred to as Magi Medicaid. And Magi simply means modified adjusted gross income. So it is absolutely, again, a Medicaid program based on income eligibility and being under 65 or not eligible for Medicare. Magi Medicaid also refers to what a lot of people call Obamacare. It's the Medicaid benefit that's available based on the Affordable Care Act. Magi Medicaid eligibility looks at income only and does not look at assets. And many, many people were eligible for healthcare coverage based on the Affordable Care Act coming into law. What a lot of people don't realize about Medicaid systems is that there are a lot of different programs that people can be eligible for Medicaid under. For example, in Colorado alone, there are approximately 45 different types of Medicaid someone can be eligible for. Each one of those programs, again, has its own eligibility criteria and income and asset criteria. But every state can have different Medicaid programs that they allow people to be eligible for. So it can, what's available varies from state to state. Eligibility criteria can vary from state to state as far as income and physical need. Medicaid typically, for people who may also have additional health insurance options such as Medicare or TriCare or some such, the Medicaid system will always be the payer of last resort in most situations. So if you have other health benefit eligibility, or you have other health benefits such as TriCare or Medicare, keep in mind that Medicaid will always be after that other insurance, be secondary or sometimes even third to that other insurance. So typically considered the payer of last resort. In Colorado, specifically, there are many Medicaid programs that are crafted or designed more specifically for older adults. And we also participate in a Medicare savings program. Now, a Medicare savings program I've talked about in the last couple of weeks. It is a financial assistance program specifically for people with Medicare that can help cover some of the costs of Medicare, such as the Medicare Part B premium. Technically, Medicare savings programs are not Medicaid because these are solely funded by federal dollars. But what the government has realized is that the easiest way to manage these benefits and beneficiaries and to apply for these benefits is through the state Medicaid system. So to apply for a Medicare savings program or help with your Medicare costs, you actually have to fill out a Medicaid application. Other programs that might be specific to older adults can include a cash subsidy benefit, Medicaid long-term care benefits. So there's a program called OAP, Old Age Pension, which is a horrible name, but that's what it is at this point. So OAP provides a cash subsidy for people who have very, very low income, federal poverty level or less, or it can also subsidize SSI benefits, which is a very, very low income benefit. Anybody who qualifies for this benefit, this cash subsidy, typically automatically also gets full Medicaid benefits, regardless of whether or not they have Medicare. Long-term care programs are designed to help care for people, whether it's in the community under home and community-based services, which is a program that provides people with in-home assistance, or if it's at an assisted living facility or any 24-hour skilled nursing facility. The long-term care Medicaid benefit provides coverage or pays for those services. So it pays for that help to come into the home so you can stay at home, or it pays the room and board at the assisted living or nursing facility. Again, eligibility criteria for any of these programs is different for each program. Some income limits are higher, some income limits are lower. What benefits someone becomes eligible for does vary. People who are eligible for long-term care benefits of any sort may or may not also be eligible for full Medicaid, may or may not be eligible for any of the other Medicaid benefits. So again, because there are so many different programs and each program has its own eligibility requirements, Medicaid can be kind of confusing. Eligibility criteria can be kind of confusing. But again, anybody who needs more information or wants information or wants help with an application, that is a service that we provide through our agency, and we're happy to help. I did include a short, simple handout that talks about some of the income eligibility criteria for some of these programs. Most of this is information that we have talked about in the previous weeks, but it is something that might be handy to have just as a quick reference. I do have a question in the chat box. As a retired military spouse, my husband is Medicare and TriCare for Life. Do I follow the same steps, apply for Medicare and contact the DEER's office to change for TriCare for Life? Yes, so as a married spouse of a retired military person, if you become eligible for Medicare, you're currently using TriCare, you need to enroll in Medicare, let the DEER's office know that you've enrolled in Medicare, and your current TriCare benefits do automatically change to TriCare for Life as well. And if that's the situation you find yourself in, you would not need any other coverage to go with your Medicare. So hopefully that answers that question. Any other questions, comments? All right. Well, we are almost done. So the last thing we're going to talk about is the marketplace. Again, this is also sometimes referred to as Obamacare, a result of the Affordable Care Act that was mandated in 2014. Many of the states in this country chose to allow the federal government to manage the marketplace coverage for their residents. Colorado chose to manage our own marketplace. So we, in Colorado, the state determines what insurers will be able to offer benefits in Colorado and what those benefit structures look like. For more information about what options are available under the marketplace coverage, again, I've provided the website connectforhealthco.com. Keep in mind that this is basically private insurance. So you are going to want to compare costs, including the premiums, the deductibles, the out-of-pockets. For marketplace coverage, though, many people may qualify for financial assistance on the costs of that coverage. Again, marketplace coverage is health insurance that's available to anybody and everybody, regardless of pre-existing health issues, and those that are not eligible for Medicare. So many people were able to become insured that had not previously been able to be insured when this went into effect. If you qualify for tax credits or premium subsidies, which do reduce the amount that you have to pay, either in monthly premiums or what you have to pay in co-pays when you go for services. Again, that's going to be based on income, adjusted gross income, and household size and all those kinds of things. And it would be something that you would have to look at reporting on taxes. There is an annual enrollment period for marketplace coverage for people who don't have other insurance options. And unfortunately, the last couple of years, that enrollment period has kind of been flexible. Well, I guess it's not unfortunate. It's a good thing because it's been flexible for people during COVID. I anticipate that flexibility will probably go away and they'll go back to just their regular annual enrollment period in the next year or so. But you do have an annual opportunity to look at any of the other options available for coverage on the marketplace and switch to another option if you choose to do so with no restrictions. Again, this is benefit that is available to people for purchase who are not eligible for Medicare. So once you become eligible for Medicare, you're really not eligible to have marketplace coverage anymore. There are some exceptions to that rule. If you have to pay for Medicare Part A, you can choose not to enroll in Part A and keep marketplace coverage. If you don't have to pay for Part A and you want to keep marketplace coverage, you can do that. It's not encouraged, but you can do that. But if you get any tax credits or premium subsidies, those do go away and you have to start paying the full premium. It is also illegal for anybody who sells marketplace coverage to sell you a marketplace plan if you advise them that you already have Medicare. So ultimately, marketplace coverage and Medicare is not designed to work together. And most of the time, you can't have both. If you choose, so you can't use marketplace coverage, you cannot use marketplace coverage instead of Medicare unless you do not enroll in Medicare. But the caveat to that is you also cannot be collecting Social Security. So if this might be a situation for someone who's self-employed and chooses to go on the market instead of trying to buy small employer group coverage, you're not collecting an income from Social Security because you're still employed. So this might be a good option for you versus enrolling in Medicare. Again, if you're not eligible for free Part A, you can choose to enroll in marketplace coverage instead of paying the premium for Part A. However, it does not waive any late enrollment penalties for not enrolling in Medicare when you first became eligible. So again, it's not going to be considered creditable coverage, even if you use it as employer coverage because you're self-employed. So again, once you become eligible for Medicare, you're strongly encouraged to enroll in Medicare and drop the marketplace benefits in favor of Medicare and Medicare options. Now, for people who have Medicare, you can still go on the marketplace and purchase dental coverage or dental and vision coverage. Those benefits can be sold through the marketplace as standalone policies. And because those are not benefits of original Medicare, you would be able to buy a dental or dental and vision benefit through the marketplace if you have Medicare. So those are things to keep in mind. But again, if you are eligible for Medicare, you're not actively employed, Medicare and the marketplace health coverage are not really designed to work with each other or to even coexist with each other. So keep that in mind. As with COBRA, these laws can be complex and confusing. Please give us a call or shoot us an email if you have any questions. I did include a handout about Medicare and marketplace coverage. It's a FAQ with the email that I sent earlier. Hopefully that can answer some questions. But if not, give us a call or shoot us an email. Any questions about any of that? All right. Well, we are getting out of here early because that is all I have for you tonight. Oh, let's see. I do have a question. Okay. So how is Medicare paid? Or yeah, how is Medicare paid? If on Social Security, it gets deducted out of that. Correct. So Medicare Part B premiums are automatically deducted out of anybody's Social Security income once you start collecting it. If you're not collecting Social Security, Social Security and Medicare will bill you directly for that monthly premium for Medicare, or you would be allowed to arrange for electronic bank transfer out of your bank account every month for those Medicare premiums. Each individual does have to pay their own individual monthly premium. It's not something that can be combined as a married spouse. There is no household discount for that. So each person who is eligible for benefits has to pay individually for those benefits. And the last part is, if TriCare and go to TriCare For Life, does Medicare payment come out of retirement pay? No. Medicare premiums are either billed directly to the beneficiary or they're deducted from a Social Security income, period. So if there's a a military retirement benefit, it would not come out of that. Military retirees do pay into Social Security, so they are also entitled to a Social Security benefit. If you're not collecting Social Security, you either have to pay them directly by monthly statement or arrange to have it deducted every month from a bank account. I think that was all the questions. Hopefully I answered all your questions. If not, let me know. Any other questions or comments? As always, you're welcome to contact us with any questions or concerns after the fact. If you wanted to review this information again, a recording of this presentation will be posted to our website. I've provided our email address and our phone number, statewide toll-free number. Please feel free to contact us at any time with any questions or concerns. Other than that, if there are no other questions or comments, we are done. I do appreciate all of you hanging in there for these last 4 weeks and joining us for this Medicare series. Hopefully you found it helpful and educational. Again, anytime we can provide additional information or you would like to schedule an appointment with one of the counselors, please feel free to let us know. And if there are no other questions, I will let you all go for the evening. The sun is still up and it's shining. And I wish you all a good evening. And thanks again for joining us.